Well, World Diabetes Day is a global awareness campaign held annually today. Diabetes is a significant health concern in New Jersey, impacting a substantial portion of the population. Joining us now is advanced level practitioner in the clinical nutrition with the Molly Diabetes Education Center at Hackensack University Medical Center, Linda Vero. Linda, welcome to the show.
Thank you. Thank you. Pleasure to be here.
So today is World Diabetes Day. And so, what is the current state of diabetes in the US?
So, what we're seeing is that diabetes is increasing. Currently, when we look at statistics, 38 million Americans have diabetes. On average, 1.2 million individuals are diagnosed each year. And when we look at the forecast, we're seeing that by 2030, the incidence is going to increase by an additional 54%. So, we're looking at about 55 million Americans. So our concern here is that we see it's not really slowing down, but actually increasing.
Wow.
And why would you say type 2 diabetes is on the rise right now, especially in young people?
Yeah, well, it's a combination of factors. One of them first is inactivity. What we see is that individuals aren't as active, especially children. You know, the high incidence and time spent on video games, um, certainly, television watching. It's really something that folks struggle with, trying to get into that routine exercise program. And the key is also routine, trying to start something and then stay with it. The other thing is weight. We know that a lot of individuals struggle with their weight. So that we look around us and the foods we eat, they're very calorie and carb dense. There's a lot of added sugars, the amount that's consumed of processed foods. So especially children and teens, we see that they tend to drink a lot of sugar sweetened beverages, a lot of type of snack foods. So again, these are all things that are very carb dense and calorie dense. So it really, doesn't make it easy to watch our weight or if someone's trying to lose weight. But certainly, we know from research that if someone just loses 7% of their starting weight, that actually can help bring down their blood sugar numbers. Another thing is sleep. We know that individuals that don't get adequate sleep, it increases their insulin resistance. And when we look at type 2 diabetes, that's the main cause, is that insulin resistance. So really kind of, trying to look at your diet, trying to make those small changes, and definitely get moving and trying to get that better quality and more duration of sleep.
Now, as many as 8 out of 10 people are pre diabetic. That's a really large ratio, and they don't even know it. What are the symptoms that people should be looking out for?
So with prediabetes, the symptoms are vague. A lot of folks don't know that they have it. When we look at the incidence currently in the US, we know that there's 97 million people that have prediabetes, and a good majority of them don't know it. When someone, has diabetes, the symptoms are a little bit more obvious, where we see increased excessive thirst. So someone's drinking a lot more. We see that there's more, urination. Someone might find that they're unusually more tired, lack of energy. But we don't typically see those symptoms until someone has basically the diabetes. Prediabetes is sort of what we call the blood sugar numbers are higher than normal, but they're not quite high enough to diagnose someone with diabetes. So it's sort of we're catching it early, but they're sort of in that in between window. And that's, again, the hard part is the symptoms aren't really obvious, they're very vague.
Hmm.
So, what can we do to get this epidemic under control?
Well, the first thing we suggest is certainly trying to get moving. And if you find it's hard to get started, think of a time in your day where you can get in, even if it's just 10 or 15 minutes is a good place to start. So some people maybe can walk 10 or 15 minutes during their lunch period, or maybe on their way home, they stop at a park and they walk for that 10 or 15 minutes. So just trying to get moving, looking on the weekends, your days off, especially with children and teens. Make it a family event where on the weekend, let's go out, be more active. Let's do, walking together. Let's go hiking. It's a great time of year. The other thing is look at your food choices. Try to add more of those vegetables to your plate. Choose fruits for snacks. The idea is try to reduce the intake of processed foods. Maybe switch your beverages. Look at the food labels. How much added sugar? What's the total carbohydrates of the packaged food that I'm eating or the snack food? And the other key thing too is portion size. When we eat takeout or we eat out, we all know that the portions can be quite large. So, maybe dividing that meal into half or maybe only have a third of it and save the rest for another meal. So it's really, looking at your food choices, trying to make some nice swaps to healthier foods. Definitely try to reduce those portions and sort of get moving, and also maybe try to set up a better sleep routine so that you get a better quality or longer duration of sleep at night.
Linda, these are all great tips. Where can we learn more information?
Well, the American Diabetes Association is a great website. They have information on prediabetes, diabetes, also the nutrition, Academy of Nutrition and Dietetics. They're at eatright.org. That's a great site for, getting recipes, healthier food choices. Certainly, Molly Diabetes Center. We always have ongoing programs. You can go to our website. And certainly any local hospital in your area. If you go to their website, most of them have outpatient programs. Maybe it's a seminar, maybe it's a cooking demonstration. Those are all great reputable resources where you can get more information and find out about programs in your area.
Linda Vero, dietitian with the Molly Diabetes Education and Management Center at Hackensack University Medical Center. Thank you so much for joining us this morning.
Oh, you're very welcome. Again, pleasure to be here.
Coming up on New Jersey, visited Kean University for a very special event.